Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and I'm here again for another one of my live Q&A sessions that I have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys live, as well as your chance to get your answers to questions you might have put onto some of our videos this week. Remember to hit the like and subscribe button so you can get our latest content. And if you hit the notifications bell, you can get notified of our latest videos. And for those of you who stick around until the end, I'm going to go ahead and I'm going to give you a sneak peek at tomorrow's video. So I really appreciate everything. And I want to let you know how important it is to me that you guys are here. I really understand that it's like a really big deal for you to take time out of your busy lives to come here. And I am really appreciative. So remember, hit the like and subscribe button for me. And if you have any questions, please put them into the chat. So we're going to go ahead and get started. Oh my gosh. So we have one already. Hi, I hope I pronounced this right. Hi, Jafar. Low platelets during pregnancy, 20 weeks pregnant, and platelets are 70,000. So I'm guessing you're wondering, like, how is that going to affect everything in the pregnancy? Please, let me know if I'm off. So for those of you who aren't aware, low platelets is considered something called thrombocytopenia. Thrombocytopenia is extremely important because when you have low platelets, the job of platelets is to help to clot your blood. And so actually during pregnancy, women are at higher risk for blood clots because a lot of the clotting factors that we have are higher during pregnancy. And this is because our body knows that at the end of the pregnancy, when we deliver, we're going to be bleeding. Whether you have a C-section or a vaginal birth, you are going to lose some blood. That's normal. So we are very cognizant as healthcare providers to make sure that we are very mindful of women and their blood clotting factors, because you can't actually, like, one of the examples is vitamin D is best absorbed with vitamin K. Vitamin K is one of the things that helps your blood clot. And this is why we give babies vitamin K, and we have a video on that, right? But if you're vitamin D deficient during pregnancy, and I see this all the time in my practice, I do not recommend women take vitamin K. So even though the vitamin D supplement will be better absorbed that way, I actually tell them to take their vitamin D supplement with vitamin K foods. Vitamin K rich foods include like broccoli and asparagus and avocado, kiwi fruit. So I encourage them to use that because when we get vitamin K from our food, it is much healthier for us, right? Now, just to be clear, guys, if you have low platelets, vitamin K is not going to increase your platelet count. So when you have low platelets, again, these are part of what helps you to clot. Clot means that when you get cut, your body produces some stuff that allows you to stop bleeding, right? When you have low platelets, this becomes a concern that you might bleed out. So a lot of times when somebody has low platelets, under 100,000 is considered low. They're monitored more carefully. Now, there's two different kinds. There's basically like a congenital thrombocytopenia. Some people just have it all the time. And there's idiopathic. We don't know what's causing it. I've taken care of many women, Jafar, who've had low platelets. In fact, the lowest that I ever took care of, her platelets were 15,000. She came into the hospital with us, and she was with us for about 3 weeks before the delivery because 15,000 was dangerously low. We didn't even want her to bleed at all at home. We were trying to get her to 20,000 at delivery, and we got her to 19 before she delivered. So what was our plan of care with this patient? One of the biggest things with a patient who has low platelets is that we oftentimes will bring them into the hospital before they have a chance to go into labor. So we are there when they start labor. So if they do start bleeding, we're ready to go. The biggest thing you need to kind of decide, Jafar, is how you feel about blood products. There's all different types of blood products that people can get transfused. When we hear about blood transfusions, we just think the red blood, but you can actually get platelet transfusions. So platelet transfusions are only the platelet part of a blood product. So that's actually an option, and sometimes we'll do that. There's a whole bunch of medications that we can give you after you deliver to help you stop bleeding. So that even if your platelets are low, we can help prevent that hemorrhage. But usually somebody who's under 100,000 in their platelets, what we basically do is, as long as that patient is consenting to the ability for us to give blood, if she needs it, we don't just automatically give it. What we'll do is, at the time of delivery, we basically have like a cooler of blood products that's matched specifically for the patient. And so not only will that cooler contain red blood cells, like the traditional red blood that you guys see, but it can also contain separate bags of like platelets and other things. Now, somebody who has low platelets, and this is very important, guys, if you're a hard stick for an IV, if you have any kind of severe anemia, low platelets would be another thing. When you guys go into the hospital, I know this is going to sound weird, everybody says no IVs. I'm telling you, ask for 2. So let me be clear again, Jafar, if they do not offer it, and a lot of times with something like this, they will just ask to put in 2 IVs. Guys, if you have any kind of medical complications, preeclampsia is another one, ask for 2 IV sites, okay? I know IVs are uncomfortable. I very much get that. I've had to put them in. I mean, I've put IVs into little teeny tiny babies. It's not fun. However, those IV sites can save your life. But what happens if one blows and it doesn't work anymore? Well, now we've got to try to start another one. And so if you have any kind of complication going in, having 2 sites already there is amazing. Plus, sometimes what happens is we only have so many fluids we can put in one site, and now we need a second site anyway for something else, especially during an emergency. So anytime you guys are like going into the hospital, if you have any kind of complications, I actually encourage you to ask for 2 IV sites. It really is. While everything's calm, that's the time to get it done. Oh, Jafar, those are perfect. The hemoglobin is perfect. HB, guys, is hemoglobin. HGB is another thing, but 13.3 is good. That's respectable. And blood pressure is perfect. So that's all good. Koala, do you have any tips for weight loss, weight control during pregnancy? What if you go into a pregnancy overweight? So my biggest thing with weight going into pregnancy and while you're pregnant is to focus on whole foods. Okay. And very specifically, I have some, oh my gosh, videos on keto. So I love the ketogenic diet. The ketogenic diet is very close to what we all ate ancestrally. So ancestral dieting is very much a newer type of science that's coming out. And this is basically the idea that we eat the foods from the regions we came from. And when I say regions we came from, this is back hundreds of thousands of years, and these are the foods that in our DNA are the ones that we're best going to absorb. So when I say in our DNA, everybody nowadays is doing those 23andMe stuff. And when you look at that, it tells you what parts of the world you came from. Well, if your ancestors are primarily from Alaska, you're born for, thank you, Qual. I think mine were too. That's funny. If you came from Alaska, right, your ancestors were primarily eating seal and whale and salmon, and they were eating, of course, any of the vegetation that was close to that area. So you're going to process that a lot better than, say, somebody who's from the Caribbean. So somebody who's from the Caribbean is not going to respond so well to some of those higher fat meats, but somebody from the Caribbean is going to really burn through some of those sweet tropical fruits that some others of us basically metabolize as candy. So that's like a really big thing. But ketogenic diet is, I think, a great way to kind of eat healthy. It supports healthy weight, and it's great for diabetes. If you look at what a ketogenic diet is, it's really low carb, which can also prevent or treat diabetes during pregnancy. Now, do I recommend you do the macros? No, I don't recommend. If anybody goes real deep dive into keto, you're supposed to count macros and a certain number of carbs. You're pregnant. You need to eat. So what do? You grab a keto-friendly food list off the internet, and you basically try to focus on eating those foods. That alone is going to be a big deal. Okay, ketogenic foods are really good for you, and they avoid some of the higher carb fruits. They avoid some of the higher carb vegetables. They focus your dairy on high fat. A lot of people think that dairy should be low fat. That is like terrible, guys. Please look into this. So if you take milk, right, like cow's milk, and you take out the fat, if you guys look at it, what's left is that very thin, watery milk that's like gray in color. In fact, a lot of times they add dyes to make it look more white. In case you guys didn't know, look that up. So that thin milk, all that's left is basically sugar. That's all that is. It's like sugar water. And they've taken out the only part of cow's milk that is actually like healthy, which is the fat. The fat part of that is what we actually need. And so it's just important to understand that. And so when you're looking at a lot of these whole fat dairy products, they're actually a lot lower in sugar, and the fat that you're getting is a healthy fat. Now, am I telling you to eat gallons and gallons of like whole fat yogurt? No, but within moderation, absolutely. So this is what I'm telling you with the ketogenic stuff. I think that it's really, really, really good. They eat whole foods, but just not big ladies, rice and meat. Rice is terrible, guys. Rice is sugar, just so y'all know. And rice and beans. So rice on its own and beans on its own, they don't have the right amino acids to create protein, but together they're a whole food that's like a protein. Rice is pure sugar on its own. It's basically just a carb. Beans are also higher in carbs. Rice and beans together in small amounts is okay. But now better to eat like a whole grain rice or something like that. But all this white rice that we see everywhere is terrible. It's like candy. In fact, I was talking to one of my patients today who we currently have her on one of those 24-hour glucose monitors, like it's always monitoring her. And she was talking to me, and we were looking at the data. And one of the things she noticed, she has huge spikes after white wine. Makes sense. Alcohol is basically sugar. And after eating sushi. She has some of the largest spikes out of all of her foods after sushi, because sushi has all that white rice. And the protein that's a part of the sushi isn't enough to balance out her sugar. So it's very good for you guys to understand what some of this stuff looks like, because we think of rice as a whole food, which it is, but it's really not that good for us. Even fruit is not helpful. Yeah, but there are some fruits. If you eat fruit, guys, do the berries. So think about it. You're a caveman. What do? You're walking the land. Okay. As a caveman, you're walking the land, and you're a hunter-gatherer. So you're gathering whatever you can find. And what you're generally speaking going to find is berries on bushes or berries on the ground. Berries are the best fruits for you to eat if you're going to eat them. Okay. Jafar, during pregnancy, B12, 500 micrograms, safe? Absolutely. B12 is a fabulous vitamin. B12 is good for energy. It's also good for depression, and it is good for your cells. It is one of the building blocks for your cells. Kind of think of it as food for your cells. B12 is a water-soluble vitamin. What that means is, as a water-soluble vitamin, whatever your body doesn't need, you're going to pee out. And the only people who really have to be significantly concerned about about taking too much B12 is somebody who's got kidney disease. So those are the people we'd want to be careful of. Now, I will tell you, Jafar, your prenatal vitamin should have enough B12, but I love B12. And I really think it's one of those things you can almost never get enough of. Now, guys, B12, it's an energizer. So if you're going to take it in the morning. Do not take it in the evening. Believe it or not, it could cause insomnia. Now, the other thing I like to tell people is this. If I have somebody who is B12 deficient, if I have somebody who has anxiety, I tell them to not take too much B12. So any of my patients who have anxiety and depression, I like my B vitamins for my patients separate. So a lot of people take a B complex, and that's where you have all the B vitamins in one pill. First of all, they taste horrible, they smell horrible, and they oftentimes make you feel very sick to your stomach. But second of all, while nutritionally it's good for your body as a whole, you actually lose some of the benefits of the B vitamins individually. So half of the B vitamins are calmers and half of the B vitamins are energizers. So when I have somebody who has both anxiety and depression, if they are taking all these vitamins separately, I tell them on the days they feel depressed to take the energizers and hold the calmers. And on the days they feel anxious, take the calmers and hold the energizers. Now, does this mean you're taking like 17 pills? Unfortunately. But again, our bodies were meant to absorb things through our guts. So you could actually go online and look at some of the calming B vitamins, pick up a food list that contains those, and try to focus those, say, on days that you're feeling a little anxious. So I got B12 shots during my first pregnancy. That's a good thing, but that's not normal, koala, just so you know. B12 shots are amazing, guys, but any of my patients who actually need B12 shots, I don't mean this to be insulting. So just understand, koala, I actually really believe in supplemental B12 shots. B12 shots, by the way, guys, are the best way to absorb B12 other than your diet. People who need B12 shots because they're B12 deficient, one of the first things I do is send them to a gastroenterologist because that means something is wrong with your gut. And that is a very big deal. So keep those questions coming. I'm going to answer a couple questions that came in from the videos. The first question I'm going to answer came on one of my birth control videos. I have several birth control videos out there. And it said, I'm a breastfeeding mother, 7 months postpartum. We only had sex one time. And the next day I had a menstrual period that lasts 2 days. However, I missed my next period. Am I pregnant? Please reply. So this is a great question. And I think birth control is something, especially nowadays, that we need to talk about very carefully, guys. Okay. So the first thing is, if you guys suspect you're pregnant, please take a pregnancy test. Okay. Second of all, is it possible that this person got pregnant? Yep, absolutely. So what you guys need to understand is pregnancy can happen when you are bleeding. Okay. A lot of people think the period is a time where you can guarantee that you're not going to get pregnant. But there's a lot of factors that go into place. So basically, kind of what happens is rough, guys. Okay. Period starts day one. And when that happens, hormones start to change and they're sending signals to the ovary to start to basically mature an egg. So in the ovary are a whole bunch of eggs, right? They're not actually eggs. They're kind of like follicles, basically baby eggs that have to like bloom. Okay. Think of like a seed of a flower that blooms. And so the hormones every month that we're having, they're allowing that little tiny seed, that follicle to bloom into a flower. Okay. Once it's fully mature, and this is about mid-cycle, you ovulate. And so this is around anywhere from day 12 to 15. It depends on the woman. It can be variable. So you ovulate. That means the ovary releases the egg. And the egg goes from the ovary into the fallopian tube. Okay, so we have a fallopian tube here that goes down to the uterus. So the sperm are supposed to go up into the fallopian tube. They meet the egg. they fertilize the egg, and then the egg continues to travel back down until it gets to the uterus and it implants into the side of the uterine wall. Great. The thing is, some women will ovulate more than once in a month. Some women can ovulate 2 or 3 times. It depends on the woman, and honestly, some women may do that more than once in their lifetime. It can be random. Second, sperm live for more than one day. So sperm can actually live for a couple of days inside your belly, which means you might not have ovulated the day you had sex, but you could have ovulated 2 days later, and there could have been some sperm that was alive, and voila, you have a fertilized egg. Third, you guys can have already become pregnant and not even know it and get your period. I get a lot of questions about first trimester bleeding, and that's actually one of the causes of first trimester bleeding is you're actually still having a period because your body doesn't realize it's pregnant yet. So there's a whole bunch of things here. Ultimately, if you do not want to get pregnant, you need to make sure you're looking at all of your options for birth control so you choose the right one for yourself. Now, is it very likely? Is it safe? How do I want to put this? Was it a safe bet to have sex, unprotected sex during your period, thinking that you wouldn't get pregnant? Of course, I would completely agree. But nothing is absolutely 100% set in stone. So, is it possible? Yes. And that's what you guys need to understand. Okay. Anybody who has any questions, please feel free to put them into the chat. And if you guys have any more questions about birth control, of course you can ask them, but I have a couple videos now about birth control. So please check those out, including what options you have for birth control, including barrier methods and the hormonal methods and all that other stuff. But I also have some very clear natural family planning stuff. Okay, so newborn care videos. I have a video on how to care for your baby. This is kind of like the basics of newborn care. And the question was, how cool is a cool bath? So a baby's bath temperature should be about what a normal body temperature should be, which is 98.6 degrees Fahrenheit, which is between 37 and 38 degrees Celsius. Okay. There are lots of different ways to check the temperature of the bath. You can buy thermometers and stuff like that. So I definitely recommend that you do that. Here's the other thing though. Okay. And the same thing goes for like when you're, warming up milk or something. When you check the baby's bath, great. Use a thermometer, right? But also right before you put the baby in the bath, put your hand in the bath. Okay. If it feels too hot for you, it's definitely too hot for the baby. If it feels way too cold for you, it is probably too cold for the baby. So if you feel okay with this and your temperature reading is that range, you're good to go. Now, I said 98.6 degrees Fahrenheit, right? You're not going to be able to get it perfectly 98.6 degrees, okay? When you're going to set the bath temperature, I would aim a little bit higher, not a little bit lower. Especially early in life, the babies have a hard time warming up. So it'd be better to aim on the higher side than the lower side. Now, let's say you aim your bath temperature for say 99.2 degrees, okay? I am not advocating that you put the baby into the bath at 99.2 degrees. Understand that water starts cooling down very fast. So if you give it just a little bit of time, that 99.2 degree water is going to get down to 98.6 degrees. But if you start out, say, at 98.1 degrees, it is going to continually get cooler. And very quickly, it's going to be too cold for the baby. So definitely, guys, that's one thing I would tell you is to, kind of be wary of that. Okay. All right. Let's see what we have next. So I have a couple questions on, they're actually antibiotics and urinary tract infections. So my wife is 12 weeks pregnant and has a bladder infection. The doctor prescribed ceftriaxone, but since it crosses the placenta, is it safe for her to use? This is our first baby, and we're really worried about miscarriage, so I hope you can answer this question. The next one said, I'm currently 11 weeks pregnant. A few days ago, I took blood and urine tests as advised by my doctor, and everything seemed normal. However, the urine test showed bacteria present with epithelial cells at 6 to 8 and pus cells at 2 to 4. I don't have any infection symptoms. I haven't shown the report to my doctor yet because I have a prenatal visit coming up. Some people told me this is common and can be treated by drinking plenty of water. What should I do? So I love talking about antibiotics. That's one of my most popular videos. I have several videos on medications and stuff because I've realized over time this is a very big thing that people are, worried about. But I think antibiotics are very important to talk about. And urinary tract infections are very important to talk about because they're one of the most common infections that pregnant women can get. And what a lot of people don't realize is urinary tract infections can be the cause of miscarriage. In fact, it's a very common cause of miscarriage. It's also a very common cause of preterm birth. I've seen it so many times. So let's start with, how do you get it? You have a bladder. It's like a balloon. And coming out of the bladder is the urethra. It's a little tube. It's about this big. It's really short. And the urethra comes out just below the clitoris and just above your vagina. It's a little tiny hole. The reason why we tell women to wipe front is the clitoris, to back is your bottom, your anus, is because when you wipe from anus up, the anus has a lot of bacteria there. And what you can do is you can actually I should say the vagina has a lot of natural bacteria. You can wipe that bacteria up over the hole that is urethra. Now, if the bacteria goes over that hole, it's a little tiny tube and it can get into this balloon bladder. Now, the bladder, it's dark, warm, moist, perfect environment for bacteria to grow. Now, when you're pregnant, what happens is you pee a lot. So you think you're emptying the bladder, but you've got a big baby and uterus sitting on this bladder. And so normally what happens is you've got, right? So this is your bladder and you've got this urethra right here. But sometimes your bladder shifts like this. You see that? It's not straight up and down. It's shifting because you have that uterus sitting on top of it. So when you go to pee, you think you're peeing out all the pee, but there's actually a little left behind. And that's what gets infected. Now from there, you've got your bladder. You've got two ureters. Again, two small tubes, and these lead to the kidneys. So the kidneys are an organ that filters your blood. So it's very, very vascular. Lots of blood is going through there because it's taking toxins out of your blood to make the urine that you pee out. So if you get a bacterial infection that goes up to your kidneys, what ends up happening is it can turn into sepsis. Sepsis is a blood infection. Now that sepsis travels through your bloodstream and eventually it gets to the placenta, which is the organ that's feeding your baby, and it crosses the placenta into the baby. It can be life-threatening for the baby. So this is why urinary tract infections are so important to be treated. Now, they are bacterial infections. So that means that they are treated with antibiotics like ceftriaxone. And antibiotics are designed to kill this bacteria. It's very, very important, guys, that if you decide to take an antibiotic as prescribed by your physician or midwife, that you take it all. You cannot take some of it. You will start to feel better after a couple of days, but you still have bacteria in your system, and that allows them to create a defense, and that's what creates antibacterial resistance. So if you start an antibiotic, you have to finish it. Okay? Now, the thing that drives me crazy is a lot of people are out there saying you can treat urinary tract infections naturally. And I disagree. Okay? I'm very homeopathic, guys. I have a lot of patients who take only vitamins and supplements. It's very, very important to me that we treat our bodies holistically. That's why I order labs. That's why I encourage diet. This is a big deal. But pregnancy, you are growing another human being who's exposed to all of your blood. That baby is very vulnerable to anything that's happening in your body. And if you are sick, that is a very life-threatening situation for that baby. So it's important that your infection is treated properly. Drinking a lot of water does not treat a urinary tract infection. Cranberry juice does not treat urinary tract infection. D-mannose does not treat a urinary tract infection. So when I say treat, I mean cure an infection that's already there. Doesn't happen. Once the bacteria is established, only thing that can take care of it is antibiotics. Now, the second question referenced some abnormal lab results. Can I say that it could absolutely be a normal finding? Yes, because sometimes we get some of this stuff in a urine sample because of poor collection. If you don't wipe yourself right, if you don't do it exactly right, you can actually show up as looking like you have an infection when you don't. So if we are not sure, we retest. That's it. If the bacteria is still there, you need to take your medication. That you need to take an antibiotic. That's it. Now, prevention. You can prevent urinary tract infections by using D-mannose. You can prevent urinary tract infections by drinking a lot of fluid. You can prevent urinary tract infections by drinking cranberry juice potentially. And you can prevent urinary tract infection through a lot of other things, which are located in my urinary tract infection video. Please check it out. Self promotion, right? So cranberry juice, it needs to be the real stuff, guys. It cannot be that ocean spray stuff that has dye in it. It needs to be the real deal, like really gross, bitter cranberry juice with no added sugar. And if you have diabetes, you can't drink cranberry juice. D-mannose is a supplement. You can't take it if you're pregnant, okay? It is a supplement, which means it's not FDA regulated. It's too off label. But if you're not pregnant and you're, a woman who suffers from them, that can be a good option. So it's just, I really want to make sure you guys understand how important it is to treat your urinary tract infections properly. Hi, movie mode. Okay, so I've been trying to get pregnant again since my last miscarriage. After the pregnancy, I've been bleeding lightly 3 days. Then I had I think it's implantation bleeding. And I recently had some 3 days of spotting. I thought it was implantation again, but on the 21st of December, my period came. Could this bleeding be the ovulation bleeding? I don't think so. I think it's probably your regular cycle. I mean, I don't think it would be ovulation bleeding. Do you have advice for sex during this light spotting once I see this happening, as it's my second time seeing this pattern? Lastly, does evening primrose and red raspberry help with strengthening the cervix, or it helps with inducing labor? Got it. Okay. Sex during spotting. I don't think I necessarily have a lot of advice for sex during spotting. I think the biggest thing, guys, especially movie mode and anybody else who's trying to get pregnant and you're trying to track everything, is understanding when you're ovulating. And if you are able to do this, there's a lot of different methods of tracking ovulation. If you can do more than one, the strips being the best one, that's the most important thing. Is because really, honestly, part of this is that if you thought that was when you were ovulating, you actually don't want to have sex the 3 to 5 days before that. So it is kind of a known thing. This is why they do, this is one of the reasons why they do, one of the things they do as part of timed intercourse when you're doing like IVF infertility stuff, is that they will actually ask that the male partner does not ejaculate. That means have an orgasm until for the 3 to 5 days before ovulation when you start to have sex, because that gives you the high chance of having the best sperm quality with the best motility, that's movement, to allow the highest chances of getting pregnant. So the thing is that as far as sex, it's not about the spotting. Honestly, people can get pregnant through all sorts of different types of things, including massive, like sexually transmitted infections. But it's more about what was going on at that exact time. Were you ovulating? Were you not ovulating? I'm just looking at your stuff again. The light spotting Is just the only other thing is that keep track of that, because if that's continually happening, yeah, you want to know if you're ovulating during that time, because you may need to track your hormones. If you're having trouble getting pregnant movie mode after like 3 months or so, and you're still continuing this pattern, then that sounds to me hormonal. Now, evening primrose and red raspberry leaf. No, usually helps with evening primrose, definitely ripens the cervix, guys. So evening primrose oil is a supplement, and it definitely helps to soften the cervix. Red raspberry leaf is also used when it comes to labor. Now, understand, both of these supplements are really good for female health. They're really good for your hormones. You will read a lot of stuff that says it can help with that. That is all true-ish. But these two supplements help you get ready for labor. Doesn't matter if they help the other stuff previously. If you have two supplements that can help you with labor, we know this, do not take them when you are pregnant and not ready to have labor. Okay? Because what if you're the person who has more of those effects than the other effects that might help with pregnancy? Okay? I really, really, really try to avoid supplements during pregnancy because you never know what's going to happen. And ladies, this includes, I say supplements all the time, right? This includes tea. You guys need to be careful of tea. Tea is not regulated. You don't know what kind of stuff is in it. And it includes essential oils. I really need to do a video on essential oils. I don't know why I haven't done one yet. So, essential oils are amazing, guys. They have so many different health properties. If you get really good quality ones, they can be used for so many different things. Like, essential oils are a big deal. They are really, really amazing supplements, and they are well absorbed in the skin and all this other stuff, right? Okay, here's the deal though. You know why I don't recommend essential oils? Because they are so complex. You can actually get a certification in them. And I don't have that certification. I can give general ideas about them, and I definitely know certain things to educate people on. But I actually, in my practice, do not officially say do this essential oil or that essential oil, other than aroma. I'm comfortable with aroma, which is smelling, but nothing on the skin, because I don't feel I have the education level that's high enough to recommend that. Because some of these oils, if used improperly or if they're too strong or too weak, will not have the effect of the intended use. And some essential oils are linked with miscarriage. So you have to be really careful with this stuff, guys. The only two essential oils that I ever talk about in my practice are both used postpartum. And one is fennel. And if you drink fennel, it can actually help to increase your milk supply. And the second one, and when I do fennel, I usually recommend fennel oil by doTERRA. I don't own any stock in doTERRA. I don't sell it. I know it's like something you can sell. doTERRA, not a paid sponsorship. I wish it was, right? But doTERRA is a very high quality essential oil, and it's pretty safe, and they have a really good process, which is why I feel confident saying their brand name. After that, I don't know of the other essential oils enough to say whether it'd be good or not. And the fennel oil, you drink like 1 drop a day in your like water or something. And then peppermint essential oil, if it's applied to the breast or to like the armpit, can actually help to dry out your milk. And the biggest thing with that is that you have to be careful that the baby doesn't touch it, because a lot of these essential oils can actually burn your skin. So please feel free to put any of your questions into the chat. I have 2 questions left, but they're on the same topic. So I'm going to go ahead and answer those. So they're on placenta previa. So the first one says, can I deliver my baby at 40 weeks if I have placenta previa? The second one says, I'm 32 weeks pregnant with a low-lying placenta. I saw the doctor yesterday and they said my placenta still hasn't moved. I've been in the hospital 3 times because of bleeding. My pregnancy is through IVF and I'm scared to have a C-section. So these are 2 great questions about placenta previa, which is a very serious condition. So placenta previa is related to the placental position. The placenta is the organ that feeds your baby, right? So uterus, cervix. Cervix should be long, thick, closed. Now, everybody wonders what your mucus plug is. Your mucus plug is like a little bit of like mucus that sits in the cervix, right? This is what your cervix does. This is almost perfectly a cervix. Your cervix has to be able to open, to dilate. So there's always going to be a slit. That's where the mucus plug sits to block this from getting bacteria that goes up into the uterus. Okay. So mucus plug, cervix. Okay. Placenta. This is a complete placenta previa. This is where the placenta completely covers the cervix, okay? This is a partial placenta previa. That's where part of the cervix is covered. This is a low line. That's where it's sitting right next to the cervical opening, okay? Now, you can start with a complete placenta previa. You can be like this, but by the end of your pregnancy, your placenta is up and to the side on your uterus. That's because placentas can migrate or move, right? So they can kind of, as the uterus it goes small and it gets big, right? So as that uterus goes big, the placenta can kind of move with it, okay? Now, when you have a placenta previa, okay, the placenta is a whole bunch of blood vessels. That's how it's feeding your baby. So normally what happens, uterus has a whole bunch of blood vessels. Placenta does too. They attach together. They create this bed that transfers back and forth all the nutrients and like all that good stuff for your baby. Nutrients, toxins, all that good stuff, right? So that placenta is supposed to be here. Now, when it's over your cervix, it's still going to do the same thing. But now imagine this is all open blood vessels. So when you dilate, all the blood vessels that are here are now exposed, and then you start bleeding. That's why the one person who was questioning says she's been bleeding. She's got this partial that's sitting here, and she's probably slightly dilated, so there's a lot of bleeding. Where I come from, where I practice, your third bleed, you're in the hospital for the rest of your pregnancy. So it's interesting that she keeps getting sent home. Some places will even do the second bleed. The second time you're bleeding with an identified complete placenta previa, partial, or low line, you're in the hospital. Why? Because if you have a complete previa and you dilate, that is a medical emergency for you and the baby. And it is more of a medical emergency for the baby. Because remember, the baby is requiring this blood supply. So if you don't have this blood supply, right, and you go ahead and if you start dilating and bleeding out, the baby doesn't have a complete blood supply, baby can become anemic and it's life-threatening. The other thing is somebody like Jafar, who earlier in the live tonight was asking about the platelets, low platelets, that's putting Jafar at higher risk for bleeding. Now imagine if you've got a placenta previa and you're able to just bleed out regularly, life-threatening. So do you need a C-section? 1,000%. Okay, if you've got a complete previa, there is no way to get a baby out past the placenta. The second you start dilating, you're in a life-threatening situation. So if you have a complete or a partial placenta previa, it is 100% a C-section. Normally, we are actually delivering you early, sometimes as early as 32 weeks, but nowadays we're going for usually 36 weeks if we can. Basically, we need to deliver you before any type of dilation happens, even 1 centimeter. So usually a lot of moms will be admitted to the hospital by 34 weeks on continuous monitoring. So we can watch everything and try to keep you pregnant until the very end. For my person who sent in the question saying she was an IVF pregnancy, you worked very hard for that baby. Have them schedule a C-section and make sure they get that baby out of you long before you have to worry about any bleeding out from a placenta previa, because once you're bleeding out from a placenta previa, it is a medical emergency. And you work so hard. Let's just get that baby out. And just so you guys know, C-sections are scary. I get it. I have a million videos on C-sections. Please check them out. I have a video on what you can see in the operating room, what it's going to look like. Planned C-sections are like amazing, guys. Okay. So the emergency C-section, yes, I get it. I've been there taking care of people, right? They're not fun. They're scary. They're more scary for you guys sometimes than for us. I think we throw around the term emergency a lot when we shouldn't. And sometimes they're more urgent than emergent, but it doesn't matter. You're all of the sudden going from a vaginal birth to a C-section. That's scary. But planned C-sections, guys, oh my gosh, you get to pick the date. I recommend Tuesday. You come in, everybody's back from their weekend, so everybody's rested. All the managers are there, all the anesthesiologists, all the extra surgeons, all the techs. They have a bed for you. They know you're coming, so they have a bed for you, right? You have all the nursery staff, you have all the oh my God, it's amazing, guys. It's like boom, boom, boom. The best births ever. Even if your baby had a complication, had to go to NICU, everybody is like full staffed. Way better to have this planned C-section on a Tuesday at 11:30 a.m. than say a random Saturday night at 2:20 in the morning. So if you're going to have a C-section, I think planned C-sections are the best. Jalen, I got off birth control after years of being on it, and ever since my first period for acne. Now irregular periods, 6 months post birth control. Will I struggle with getting pregnant? Jalen, yes, you might. So it can take up to a year for your body to regulate after you've been on birth control for that long. However, we have a huge incidence of PCOS, polycystic ovarian syndrome, in our country, and actually all over the world. Please check it out. I have a video on it. Polycystic ovarian syndrome is driven by a high testosterone level, amongst other things. So polycystic ovarian syndrome, if you have high testosterone, there are ways to manage that through diet, exercise, and medication. One of the medications being metformin. That would also cause infertility. And so it's very important to understand your status. Now, here's the thing, guys. I actually just talked to a postpartum mom today. Sorry, I think I'm going to sneeze. And so I was talking to her today. She has a history of PCOS, and she's coming to me in this case for postpartum depression and anxiety. Hormones are a big part of your entire journey, right? So when I'm talking to her, I'm getting her history, seeing what supplements she's taking. And one of the things she told me is she's taking zinc. And I'm like, why are you taking zinc? Now, zinc is really good for you guys, is really good for your immune system. She says, I'm taking it for my immune system. Awesome. Are you like immunocompromised? She said, no, right? Okay. Zinc at high levels is amazing for men because zinc at high levels increases testosterone and testosterone production. So this is why it's so important to understand everything you're putting into your body. Okay. I love zinc. I recommend zinc for a lot of different people for a lot of different reasons, including women. But my guys who are coming in with depression, oftentimes, especially if they have a low normal testosterone, or I just feel like they're low testosterone, even if their level is normal, I'm saying to them, take 30 to 50 milligrams of zinc. Women, we need like 15 milligrams or less. And if you're taking too much zinc, you're potentially increasing your testosterone production. And women do need testosterone. Now, same thing also. A lot of birth controls are estrogen based, right? That's how they work. Well, if you're coming off of birth control and it was an estrogen based birth control, your estrogen levels need to like regulate, right? Well, if you're eating, say, a lot of soy products, soy can increase your estrogen levels. And therefore, you could have a problem. And so this is why it's also important. And then in that aspect, there's actually this amazing shake for postpartum depression that I talked to the company who makes it. It's a pharmaceutical company. It's like amazing. The main ingredient in that shake is wild blueberry. And wild blueberry has an antioxidant effect that helps to regulate estrogen. Well, knowing that, somebody who might be having some estrogen irregularity, incorporating a lot of blueberries into their diet, which it's an antioxidant, it's like a fruit that's very healthy for you, part of the keto diet, as you discussed earlier. That's one way to potentially look at your hormones and to help regulate them naturally without putting a whole bunch of chemicals into your body. Now, guys, I've talked a lot about natural stuff tonight. Just so you know, I believe in drugs, okay? I believe in antibiotics. I believe in antidepressants. I believe in stuff like metformin. You know, pharmaceuticals hold a very, very important place in our medical care, but there is also something to be said about the holistic side. Jalen, if you have a doctor who's willing to look at it, you should have all of your hormones checked. Testosterone, the full panel, not just the one singular level. There's a whole panel, guys. You should have your full thyroid panel checked. Again, guys, everybody likes to check TSH, which is thyroid stimulating hormone. If your doctor checks TSH only, they are not checking your thyroid. Just to be clear, that's TSH on its own means absolutely nothing. There is literally no data with that. And any doctor who's pulling just that, there's no point. So you need a full thyroid panel. Cortisol level, make sure your cortisol level is done in the morning. Estrogen, there's a full estrogen panel. Progesterone, prolactin, FSH, and LH. Those are all the hormones you definitely need. There are some other hormones after that, but those aren't really necessary at this time. That is the true way to figure out where you're at, Jalen. Honestly, you're 6 months post stopping your birth control pill. I would be checking your hormones if you are my patient, because that's enough time to figure out where you're at. Now, could your levels be abnormal? Absolutely. How are we supposed to correct them if we don't know what's going on? Now, if your levels are normal, then we have the data to understand that you have normal hormone levels, but you have an abnormal period. So now we need to say, what's going on? So I hope that helps. Any of you guys, if you have any questions, please let me know, but I am done. For those of you guys who stuck around until the end, a sneak peek at tomorrow's video is I have a video. Hold on, producer. Is it Midwife versus OB-GYN tomorrow? Yeah, sorry guys. We make so many videos, I forgot. So tomorrow's video is OB-GYN versus Midwife. So what are the differences between these professions, okay? Not everybody should get a midwife. I love midwives. In fact, it's kind of heavily swayed towards midwives, but some people really do need an OB-GYN. So this is your chance to really understand what the differences are between these two professions, and also whether you might benefit from having both, which is also actually a thing. So check it out. It's my OB-GYN versus midwife video. I appreciate all of you guys so much. I am Dr. Samantha, the maternity mentor. I am here every Monday, especially this Monday. Happy Christmas Eve, right? I will be here next New Year's Eve. So please check me out. Please. Happy Hanukkah. I hadn't even gotten there yet, but happy Hanukkah to those who celebrate. For those of you guys who aren't celebrating any of these holidays, I wish you a very happy non-holiday season, and hopefully you can go do something fun, since the rest of us will be with friends and family and doing all sorts of stuff that's not always fun. And of course, we've got New Year's Eve coming up, and I will be here next Monday at 9 p.m. Eastern Standard Time to answer your questions live. I am Dr. Samantha, the maternity mentor. I appreciate everything. Like and subscribe. Bye for now.